Taste and smell are examples of chemoreception, in which specific chemical compounds are detected by the sense organs and interpreted by the various regions of the brain. Sense of taste, or gustation, is received predominantly by the taste buds in the tongue and is transmitted with the facial, glosopharyngeal, and vagus nerves. It is interpreted in the postcentral gyrus of the parietal lobe. Sense of smell, or olfaction, is received by the nose through stimulation of hair cells in the olfactory epithelium, a specialized neuroepithelium in the upper nasal cavities. It is transmitted by the olfactory nerves, then it is transmitted to the limbic system and the temporal lobe of the brain. Examination of taste buds. So for the procedure, examine prepared slides of taste buds and compare them with figure 21.1 as shown in the slide. Note how the taste buds are located on the sides of the papilla on the tongue. Taste buds appear lighter than the surrounding tissue and are composed of neural and epithelial tissue. For us to locate taste buds, we must first know about taste papillae. The taste papillae are a good number of wart-like bumps under the mucous membrane of the tongue wherein taste buds are found. There are three types of taste papillae. On the image on the top left corner is the image for the fungiform papillae. These are mushroom-shaped structures that protrude from the surface of the tongue. Below it is the image for the foliate papillae. They are folds on the lateral sides of the tongue containing over 100 buds. Right next to the first image is the image for the circumvallate papillae. They form an inverted V at the posterior or at the base of the tongue. These papillae are embedded into the tongue and have a moat around them. Below that image is the image for the taste buds. So for the microscopic structure of the taste buds, the long circular structures that we can observe are the basal cells present in the taste buds. The white cheeks in the cells are the supporting cells, wherein the cells in between them are the taste cells. Along the tips of supporting cells and taste cells are the taste pores and taste hairs. Taste determination of solid materials. For something to be tasted, it must be in solution. This allows the fluid to run down the sides of the tongue papilla where the taste buds are located. To test this theory, we can do a simple experiment. So for the procedure, blot the tongue thoroughly with a paper towel, making sure that the surface is relatively dry. Next, have someone select either sugar crystals or salt crystals and place a small scoop on your tongue. Next, keep your open and do not swirl saliva around. Try to determine the nature of the sample. After placing either the salt or sugar crystals on my dried tongue, I was not able to taste anything and therefore I failed to determine whether the sample was sugar or salt due to not being able to taste the sample because of the lack of saliva, which helps in the sense of taste. Mapping the tongue for taste receptors. There are 5 primary classes of taste: sweet, sour, salty, bitter, and umami. Umami gives meat and cheese their particular taste, which can be referred to as a taste of savoriness. We have varying degrees of sensitivity to these 5 tastes. Some of us find the bitter tastes to be especially questionable, whereas others do not seem to mind them as much. To determine the differences in sensitivities to taste, an experiment can be conducted. So for the procedure, first, using a sterile cotton-tipped applicator stick and a dropper bottle, apply one of the 5 tasting solutions: salty, bitter, acidic, umami, or sweet to the cotton. Saturate the swab. Next, dab the entire surface of your tongue and determine by nod or hand signals when perception of taste occurs. Do not have them tell you about the taste at first because the movement of the tongue will wash the solution to the other areas of the tongue and you may get a false reading. Next, using a figure of the tongue, draw on the figure where you perceive the specific sensations of tastes. Note, note the areas that are more sensitive to some tastes. Next, repeat the test with a new applicator stick for each of the 5 solutions. And lastly, create and compare the taste map of the members of the class with yours. Taste maps are sometimes misunderstood and misinterpreted by people. The areas wherein tastes are labeled do not mean that specific taste can only be exclusively tasted in that part of the tongue. Rather, it is the area wherein there are small significant differences in the perception of taste due to sensitivity. Transmission of sense of olfaction to brain. For the procedure, examine a model, chart, or diagram of a mid-sagittal section of the head or a model of the brain and locate the olfactory nerve fibers, cribriform plate, olfactory bulb, and olfactory tract. The olfactory nerve is the first cranial nerve. This nerve enables the olfactory system and sense of smell. It starts in the brain and ends in the upper inside part of the nose. The cribriform plate of the ethmoid bone forms the roof of the nasal cavity and represents the lowest portion of the anterior midline skull base. The cribriform plate transmits the olfactory nerves that carry the sense of smell. The olfactory bulb is a paired structure situated in the anterior cranial fossa, directly inferior to the orbital aspect of the frontal lobe. The olfactory bulb acts as a relay center for the transmission of the impulses from the olfactory nerve to the olfactory tract, and then to the cerebral cortex or the olfactory cortex. The olfactory tract runs posteriorly along the olfactory sulcus and ends in the olfactory trigone. The function of the olfactory tract is to connect the olfactory bulb to multiple areas within the center of the brain.
Activity 5 Olfactory Reflex. The experiment aims to test if the olfactory reflex is triggered by exposing a group mate to the scent of household ammonia. If there is a visible movement of the head in the posterior direction, it shows that the olfactory reflex is activated, indicating the individual has detected the strong odor of ammonia. This demonstrates the functionality of their olfactory system. For the procedure, place a small bottle of household ammonia under the nose of your groupmate. Then have them take a brief sniff from the bottle. If there is a visible movement of the head in a posterior direction, then your groupmate demonstrate an olfactory reflex to smell. Record the result of your experiment. Yes, there is a visible movement of the head in a posterior direction in response to its typically strong pungent odor, indicating the presence of olfactory reflex to smell. When an individual encounters strong or nauseous odors like household ammonia, the olfactory system quickly detects these stimuli and responds sensory signals are transmitted to brain, triggering the reflexive movement away from the source of the odor. What might be the adaptive benefit for the people having an olfactory reflex? The adaptive benefit of people having olfactory reflex is that it helps individuals protect against harmful substances or strong odors, aiding in staying safe, finding food, and responding effectively to such stimuli in their environment. Therefore, having this reflex is important for staying safe and understand the world around us. Activity 6 Visual Cues in Smell Interpretation. In this section, an examination of the influence of visual cues on the interpretation of smell will be conducted. Determine whether the color of a substance has may effect on what you perceive the smell to be. For the procedure, have a group mate to show you a small vial labeled almond and then smell it. Then examine of the smell of the small red vial labeled wild cherry. Determine if you perceive the two smells as separate smells. Close your eyes and have your groupmates select a veil for you. Try to tell which one is which. In smell tests, I was able to correctly identify the almond and wild cherry scents because the label on the vials guided my expectation. Additionally, the scents from the vial labeled wild cherry and almond are perceived as separate because they have distinct scent characteristics. Wild cherry typically has a fruity, lightly tart aroma, while almond is characterized by a sweet, nutty scent with floral undertones. These differences in scent characteristics allow me to differentiate between the two smells. However, when blindfolded, I could not determine the identity of the veil presented because I could not see the label of the color of the veils. Without visual cues to guide my interpretation, my ability to identify the scent was hindered. Activity 7 Olfactory Discrimination. This experiment tests participants' ability to distinguish between different scents by presenting them with four vials containing various aromas. With their eyes closed, participants must identify each scent, recording how many they get correct out of four. This evaluates olfactory discrimination and sensitivity. For the procedure, obtain four vials of different scents: peppermint, almond, wintergreen, and camphor. While keeping your eyes closed, try to determine the name of each essential oil as your groupmate presents it to you. Record how many of the scents you get correct out of four. If you are hypersensitive to smells, have your group mate to this section of the experiment. I correctly identified four different scents. The scents provided in this experiment are relatively easy to classify due to their distinct and recognizable aromas, such as peppermint, known for its cool, minty scent, almond with its sweet, nutty aroma, wintergreen, associated with a refreshing minty scent similar to peppermint but with distinct differences, and camphor, recognizable for its strong medicinal aroma. Each scent has unique characteristics that make them distinguishable from one another, allowing for relatively easy classification based on their individual aromas. Activity 8, Adaptation to Smell. Adaptation to smell by the olfactory receptors occur very rapidly, but the adaptation by the receptors is incomplete. Complete adaptation to smell probably occurs by additional central nervous system inhibition of the olfactory signals. Determine approximately how long olfactory adaptation takes. For the procedure, have your groupmate record the time when you begin the experiment and how long it takes for the perception of smell to decrease significantly. Close your eyes and plug one nostril. Inhale the scent from the vial of dilute perfume until the smell decreases significantly. How long does it take? Length of time to significant reduction of the smell is 1 minute. What might be the evolutionary advantage of adaptation to smell? Adaptation to smell help us focus on detecting new or changing odors in our environment, which could indicate potential threats or opportunities for survival. This ability to detect changes in smell allows for more efficient allocation of sensory resources and better adaptation to the surrounding environment. Prediction whether adaptation to one smell causes adaptation to another smell. Adaptation to one smell likely does not directly cause adaptation to another smell, because each smell activates specific olfactory receptors in the nose and adaptation occurs independently for each other. When we are exposed to a particular smell for a prolonged period, our sensitivity to that specific odor decreases over time. Therefore, experiencing adaptation to one smell should not affect the perception of other smells. Now smell the wintergreen or peppermint veil. Does the adaptation of the one smell causes the olfactory receptors to adapt to other smells? No, the wintergreen or peppermint veil will not cause adaptation to other smells, as the receptors for those specific odors would remain unaffected by exposure to different odorants. Therefore, adaptation to one smell does not cause the olfactory receptors to adapt to other smells. Activity 9, Taste and Olfactory Test. This experiment demonstrates the dependence of the sense of smell as a component of what we call taste. For the procedure, obtain 4 or 5 small drinking cups and using a marking pen, label each with the name of the fruit juice or nectar it will contain. Have your group mates select several types of fruit nectars and pour each into the proper cup. Sit with your eyes and nose closed and try to identify the sample presented to you by your group mate. Your group mate should place the sample cup in your hand and you should guess what fruit nectar is in the cup. After tasting the sample, try to name it. Test all of the samples with your nose closed. After you make your determination, release your nostrils but still keep your eyes closed and taste the sample again. Record the results. When my nose was closed, I will found it challenging to accurately identify the fruit nectar sample of the apricot because it tastes like peach. This could also be due to my limited ability to perceive it without normal airflow through my nasal passages. However, I could still identify the smell of mango, coconut or pineapple, strawberry, peach, and apple even with my nose blocked. However, when I opened my nose while keeping my eyes closed, I immediately noticed a difference and I could accurately identify all the scents including apricot. This indicates that with unrestricted airflow, I could detect the subtle characteristic of each scent more effectively. allowing me to correctly identify all the samples. Overall, the results suggest that while some scents are more easily recognizable even when close-nosed, others, like apricot, may require normal airflow for accurately perceptions.
So let us proceed to exercise 22, eye and vision. For the first activity that we had, we were to examine our lab partner's eye. So the external structures that we can observe are the eyebrows, eyelashes, the eyelids, iris, pupils, and other more. Now let me discuss the major structures of the eye. First, we have the sclera, which is a firm white tissue that covers all of the eye except at the very front. Cornea, which is a transparent portion at the center front part of the eye that allows light through. Conjunctiva, which is the thin outer mucous membrane that covers the inside of the eyelids. Ciliary body, which is a group of muscles and ligaments that attach to the lens. Iris, which is the group of muscles that controls how much light enters the eye. And eyelids, which help keep outside particles from getting in your eye. As we proceed to slide 12, we can clearly see the major parts of the eye. So we have here the iris, the cornea, the lens, ciliary body, and other more. As we proceed to the next slide, we can see here a sample of a cow's eye. So here we can locate the sclera, the cornea, and the optic nerve, which is comprised of millions of nerve fibers that send visual messages to your brain to help you see, and some excess fat and muscle tissue. Moving on to the next activity, which is the extrinsic muscles of the eye. Attached to the sclera are the 6 extrinsic muscles. So what are these extrinsic muscles? First, we have the lateral rectus muscle, which abducts the eye or moves the eye away from the midline of the body. It also facilitates the outward gaze of the eye. Next is the medial rectus muscle, which adducts the eye, bringing the eye closer to the midline of the body. It also facilitates the inward gaze of the eye. Next, we have the superior rectus muscle, which elevates the eye and is responsible for the upward gaze and contributes to the adduction and intorsion of the eye. Next is the inferior rectus muscle, which depresses the eye and is responsible for the downward gaze and contributes to adduction and extorsion of the eye. Next, we have the superior oblique muscle, which depresses the eye when it is in an adducted position. Lastly, the inferior oblique muscle, which elevates the eye when it is in an unadducted position. In the following two slides shows the location of these muscles in the eye. When comparing the first model shown to the figure found on the manual, the muscles' location are just the same. In the next activity, we were to observe a prepared slide of the retina and compare what we saw in the slide with figure 22.8. So the retina is a thin tissue that contains blood vessels and light-sensitive photoreceptor cells called rods and cones. As we can see from slide 15, this is the retina under a microscope, and if comparing it to the figure in the book, they have the same structures. And we can also locate where the choroid is in the sample.
Using a pair of tweezers to gently lift off the retina inside the wall of the eye, the retina may tear because it is very delicate. Underneath the retina, you will find a shiny and colorful tissue. This is the choroid coat. The choroid coat is also known as the vascular tunic because it supplies the eye with blood and nutrients. In a human eye, the choroid coat is very darkly colored to minimize the reflection of light, which could cause distorted images. Notice that the cow's eye with a choroid coat is very colorful and shiny. This reflected material is called tapetum lucidum, and its reflective properties allow a cow to see at night by reflecting their light that is absorbed through the retina back into the retina. While ang cow mas makakita siya better at night kesa sa human, pero it distorts the clarity of what the cow sees because the light is reflected so much. Tapetum lucidum is also responsible for the glowing eyes of the animal. For example, is a cat. When a small amount of light reflects off the tapetum lucidum in an otherwise dark room, murag mo reflect mo flash ang eye sa cat due to the high intensity sa light sa tapetum lucidum. The macula is a spot in the center of your retina. On this spot, a small pit called fovea is located. When the light is focused on this spot, we get the sharpest image because the fovea contains very tightly packed photoreceptor cells. Macular degeneration is a common eye disease that is caused by deterioration of the macula and result in partial blindness. And the three layers fill a small part of the eye. The large middle area isn't empty, though. The area between the cornea and the lens is filled with transparent liquid material called aqueous humor. The area between the lens and the retina contains a clear gel-like substance called vitreous humor. Both of these humor help give shape to the eye and are part of the focusing process. The blood vessels and the optic nerve, the nerve that conducts electrical impulses to the brain, connect to the retina at a spot called the optic disc. On this disc, there are no rods and cones. This is your blind spot. You don't usually notice your spot because your two eyes work together to cover up each other's blind spot. Eye movement are very precisely controlled by the six extrinsic muscles of the eye. Visual tracking is the capability to track objects by moving one's eye left to right or right to left, up and down, and in a circular motions, or to focus on an object as it moves across the visual field. To determine their effectiveness, have your lab partner follow your finger as you move it in front of the eyes. Is the movement of the eye smooth, which indicates normal function, or do the eyes move in the following space? Jerky fashion, an abnormal condition.
For the measurement of binocular visual field, you can determine your visual field with covering one of your eyes and having another person move an object from behind your head towards the side until you can see the object while looking straight ahead. Binocular vision refers to the ability of an organism, typically humans, to perceive depth and three-dimensional objects by integrating the visual inputs from both eyes. So from this activity, we were able to determine the common angle of humans' binocular vision. Theoretically, we are able to see the object at 60 to 70 degrees in the left eye, and the object disappears at 100 to 120 degrees in the left eye. In the right eye, we are able to see the object at 60 degrees and it disappears in 100 to 110 degrees.
The minimum distance an object can comfortably be held in focus is called the near point. The eye's ability to focus is due to the elasticity of the lens, which decreases with age. For example, a 10-year-old can focus 8 to 10 centimeters away from the eye, yet a 65-year-old may not be able to focus closer than 80 to 100 centimeters. The stiffening of the lens becomes more noticeable around 40 to 50 years of age, when many people find reading glasses necessary because their age lenses do not accommodate as well as the lenses of a younger person. Every human eye contains 120 million rods and 7 million cones. The rods are very sensitive to low-level light, but they cannot distinguish color. Cones, on the other hand, need much more light to function than rods do, but they can provide color, information, and sharp detail. You may have noticed that in dim light, colors look much less vibrant. That is because the rods that help you see in the dark are more or less colorblind. The retina is also contains a dark pigment called melanin, also found in the skin and the hair cells. This reduces reflection of light when it enters your eye. To determine the distribution of rods and cones, have your lab partner look straight ahead. Slowly move a small colored object without letting your lab partner see it ahead of time from the back of your lab partner's head, around the side, and toward the front. Note the approximate angle when your lab partner is able to see the object.
For the measurement of visual acuity, we use the Snellen test. In this procedure, cover one eye with a 3 by 5 inch card and have your lab partner point to the largest letter on the chart. Do not read the chart with both eyes open. Your lab partner should then progressively move down the chart and note the line that has the smallest print in which you made no errors. So, as we have recorded, in the left eye, we can only read correctly up until line 9 to 10. In the right eye, we were able to read the letters correctly up until line 9, which is considered a normal vision.
Ophthalmoscope is important not only for the diagnosis of variances in the eyeball, but also as a potential indicator of diseases such as diabetes mellitus that affect the eye. To test, have your lab partner setting at 0 and use your left hand to hold the ophthalmoscope. Use your left eye to look through the scope and move in close to examine your lab partner's eye. Look into the pupil and examine the back of the eye. If the back appears fuzzy, rotate the dial clockwise, positive diopters, and see if it comes into focus. If a positive numbers provides a clear view of the eye, then your lab partner has a hypermetropic vision or farsightedness. If the image is distinct, then adjust the dial counterclockwise to obtain the negative diopter reading. If the image is clear with a negative number, then your lab partner has myopic vision, or nearsightedness. In nearsightedness, the eyeball is long and the lenses with negative diopters focus on the image farther back at the retina.
For the pupillary reactions, in a dark room, your eyes will naturally dilate to allow more light to enter, maximizing your ability to see in low light conditions. Therefore, in dim light, your pupil diameter will be dilated. When you shine a pen light briefly in the right eye, the right pupil will constrict in response to the sudden increase in light intensity. Therefore, the right pupil diameter is constricted. As you shine the light into the right eye, the left pupil will also constrict due to the consensual light reflex, where both pupils react simultaneously to light stimulation, regardless of which eye is directly exposed to the light. So the left pupil diameter is also constricted. For color blindness test, color vision is dependent on three separate cone cell sensitivities, which can be red, green, or blue sensitive. Color blindness is most common in males and relatively rare in females. Changes in the genes on the X chromosomes are the most common cause of color blindness. You can test for color blindness by matching various samples of colored yarn with the presented test sample, or you can use the Ishihara color charts. If you use the color charts, flip through the book with a lab partner and record which charts were accurately viewed and which plates, if any, were missed. In this activity, we have recorded our degree of color vision was trichromatic. Trichromatic is the most common degree of color vision in humans. It means that we have three types of cone cells in our eyes that are sensitive to different wavelengths of light. These cones allow us to perceive a wide range of colors by combining the signals from these three types of cones in various proportions.
If the cornea or lens of the human eye were perfectly smooth, the incoming image would strike the retina evenly and there would be no blurry images. In most people, the cornea or lens is not particularly smooth, and this is known as astigmatism. If you don't normally wear a corrective lenses, we can test if you have astigmatism or not. For us, we tested with a lab partner if we have astigmatism or not. First, cover one eye and examine the astigmatism chart from 20 feet away. The chart consists of a series of parallel lines radiating away from the center. Stare at the center of the chart and determine which of the sets of parallel lines you can see. If any appear light or blurry, if any of the lines look darker or thicker than the others, then you have astigmatism. If the vertical lines look sharper than you have with the rule, then you have with the rule astigmatism. If the horizontal lines pop out, then you have against the rule astigmatism. For us, my lab partner had a against the rule astigmatism because according to her, she can see the horizontal line pops out 9 to 3 astigmatism number, indicating that she had against the rule astigmatism. If you look at a bright light or an object against a dark background, then close your eyes. You can still see a light object in a dark background. This is an event of an after image. The after image can last from a few seconds to almost a minute depending on the brightness of the light or the contrast between the object and the background. The after image is due to the photoreceptors in your eye continuing to fire. After this image, the reverse occurs and you see a dark object against a light background. This is called a negative after image. The photosensitive pigment of the eye is called rhodopsin. It is composed of retinal and the protein opsin. Retinal is a metabolite of vitamin A. When light strikes to the retina, the purple colored rhodopsin splits into its component parts and become pale, a process known as bleaching. To test, see that white dot on the bridge of the woman's nose. Stare at it closely for 30 seconds and close your eyes. With your eyes closed, you should see a more lifelike image of a woman. The unnatural colors you were staring at are now gone, and you're left with a mental image that looks exactly like a photograph. Tell me, who's the woman you have seen in the image? The spot where your optic nerve connects to your retina is called optic disc. There are no photoreceptor cells on this disc, so when an image hits that part of your retina, you can't see it. This is your blind spot. You don't notice this blind spot in everyday life because your two eyes work together to cover it up. For the example 1, hold the paper at arm's length and close your left eye. Focus on the square with your right eye and slowly move the paper toward you. When the circle reaches your blind spot, it will disappear. Try again to find the blind spot of your other eye. Close your right eye and focus on the circle with your left eye. Move the paper until the square disappears. What happened when the circle disappeared? Did you see nothing when the circle disappeared or where the circle have been? No. When the circle disappeared, you saw a plain white background that matched the rest of the sheet of paper. This is because your brain filled in for the blind spot. Your eye didn't send any information about that part of the paper, so the brain just made the whole match the rest. For another example, the brain doesn't just match colored backgrounds. It can also make other changes to what you see. For example, 2. Close your right eye and focus on your left eye on the square. Move the paper until the circle disappears, and the two separated bars became a one bar. How did that happen? The circle in between the bars fell on your blind spot. When it disappeared, the brain filled off for the missing information by connecting two bars. Final example for the blind spot. In this instance, the brain just doesn't match the blind spot with its immediate white background. but instead with a pattern surrounding it. Draw a line at the center of your page. One side draw a small square and on the other draw rows of circles. Color the center red and all the rest blue. Close your left eye and look at the square with your right eye. As you move the paper, the red circle should disappear and be replaced by a blue one.
The ear is part of the special senses. It performs two major functions, hearing and balance.
So the inner ear houses a crucial system called the vestibular system, which is responsible for our sense of balance. This system consists of tiny structures like the semicircular canals and otolith organs. They detect different types of movements, like turning your head or moving forward, and send signals to the brain to help us stay balanced. So when there's an issue with the vestibular system, it can affect our balance and make us feel dizzy or unsteady. A postural reflex test is a clinical examination used to assess the integrity of a person's postural reflexes, which are responsible for maintaining balance and stability. These reflexes involve the coordination of sensory input from the eyes, inner ear, and proprioceptive receptors in the muscles and joints. So, the first step is the subject stands on tiptoes with their partner positioned nearby. Another observer watches the movement of the subject's feet. The partner gives a gentle nudge to the subject's body, either to the left or right, aiming to disrupt their balance slightly. The observer watches the movement of the subject's feet, particularly focusing on the foot opposite to the direction of the nudge. So, if the subject's foot on the opposite side of the nudge responds by adjusting or correcting the balance, it indicates a normal postural reflex. This reflex helps the individual maintain balance by counteracting the external force applied by the partner. So it's abnormal if the subject has abnormal response. If there's a delay or lack of response in the foot movement, it may suggest impaired postural reflexes or difficulties in maintaining balance. Second test is Brani's test, also known as the caloric test. It's a diagnostic tool used to assess the function of the vestibular system, specifically the horizontal semicircular canals. It's named after the Hungarian otologist Robert Barani, who developed it. This study is valuable in diagnosing vestibular disorders like vestibular neuritis, labyrinthitis, and Meniere's disease, which cause symptoms such as vertigo or imbalance. Adding a swivel chair to the Barani's test can enhance its effectiveness by allowing controlled rotation of the individual. So first is preparation. Ensure the individual is seated comfortably in a swivel chair in a quiet environment. Introduce warm or cold water or air into one ear at a time while the individual sits in the swivel chair. After irrigation, gently rotate the swivel chair in a controlled manner, allowing the individual to turn their head side to side or maintain a fixed gaze. Um, Watch for any sensations of dizziness or vertigo as well as any eye movements, nystagmus, elicited during the swivel motion. Note the direction, intensity, and duration of any observed nystagmus. So as before, warm irrigation typically induces nystagmus in one direction, which while cold irrigation induces nystagmus in the opposite direction. The swivel motion may influence the direction or intensity of the nystagmus. Interpretation. Analyze the observed responses to determine the integrity of the vestibular system and identify any abnormalities or asymmetries. So, the indications are okay, first, nystagmus or involuntary eye movements happens when warm or cold water is put into the ear during Barani's test. Here's what it means. So, for the direction, normally the eyes move horizontally towards the warm ear and away from the cold ear. If they move differently or unevenly, it could signal a problem. So, the eye movements can be strong or last longer in some cases, suggesting a bigger issue with balance. So, asymmetry. Significant differences between responses from the left and right ears may suggest vestibular dysfunction or pathology affecting one side more than the other. So, if there's no, if there is absent response, so lack of nystagmus or a diminished response to stimulation may indicate impairment or damage to the vestibular system. Vertigo or dizziness. Sensations of vertigo or dizziness experienced by the individual during the test, especially when accompanied by nystagmus, can indicate vestibular dysfunction. And other symptoms are additional symptoms reported by the individual, such as nausea, vomiting, or a feeling of unsteadiness can also provide clues to underlying vestibular pathology. The Romberg's test, performed with the subject facing a chalkboard or any surface where their shadow can be seen, assess balance and postural stability. So, have the subject stand in front of a chalkboard or a surface where their shadow is visible. Instruct the subject to stand with their feet close together and arms at their sides. Ensure the subject is not leaning against anything and maintains a straight posture. Ask the subject to maintain this position for 1 minute while looking at their shadow on the chalkboard or surface. During this time, observe for any exaggerated movements to the left or right. So, interpretation of that. Exaggerated movements such as swaying or significant shifting to one side may indicate balance problems or vestibular dysfunction. A stable posture without noticeable sway suggests good balance and postural control. So, in summary, the Romberg's test involves observing the subject's balance and stability while standing. I was standing with feet close together and without leaning, facing a surface where their shadow is visible. Exaggerated movements during the test may indicate issues with balance or postural control. So, Indications from the Romberg's test. If the person stays still and balanced for 1 minute, it suggests they have a good balance. If they sway a lot or struggle to stay upright, it might mean they have problems with balance or their inner ear. These issues could indicate a risk of falling or problems with the nerves or brain controlling the balance. Assessing balance is important for several reasons. Firstly, balance is fundamental for everyday activities such as walking, standing, and reaching, and any impairment can significantly impact a person's quality of life and independence. Secondly, balance problems can be a sign of underlying health issues, including neurological conditions, inner ear disorders, musculoskeletal problems, or medication side effects, making balance assessments valuable for early detection and intervention. Thirdly, evaluating balance helps healthcare professionals develop personalized treatment plans to improve balance and prevent falls, which are leading cause of injury and mortality, especially among older adults. By regularly assessing balance, healthcare providers can monitor progress, adjust interventions, and ultimately enhance patient safety and well-being.
This is the microscopic section of a cochlea. Cochlea is a fluid-filled, spiral-shaped cavity found in the inner ear that plays a vital role in the sense of hearing and participates in the process of auditory transduction. It comprises of multiple chambers, namely scala vestibuli, scala media, and scala tympani. This exercise is composed of multiple tests that involve hearing and balance. The first one is the audiometer test. It utilizes an audiometer, which is this device. It records the minimum sound levels at which a tone can be heard. As we can see in our tabulated data, it is in the range of 0 to 20 decibels. This is the range for normal hearing. The next test is the Weber test. A tuning fork, as we can see in this image, is struck with a patellar hammer or against the knee or elbow. The handle is placed on the forehead, as we can see in this image. The sound should be the same in both ears. Otherwise, the person may have conductive or sensory neural hearing loss. For conductive hearing loss, the sound is louder in the ear with conductive loss, while sensory neural hearing loss has sound that is louder in the ear without hearing loss. Based on the results, the sound perception is equal in both ears. This means that the result is considered normal. The next test is the Rinus test. The tuning fork is struck the same way in the Weber test, but this time it is placed in the mastoid process. This evaluates hearing loss in one ear by comparing sounds transmitted by air and by bone conduction. After striking the tuning fork and placing it in the mastoid process, the sound will diminish. Once this happens, place the fork a few centimeters from the external auditory canal. The sound adjacent to the ear should be louder than when it was held in the mastoid. If bone conduction is better than the air conduction, then there is conductive hearing loss and it is a negative Rinet's test. Based on our data, the test was positive since the sound heard via air conduction was louder than bone conduction. Now, we move on to the hearing test. We can use a ticking stopwatch, an audiometer, or a metronome application. With a lab partner, slowly have them move the metronome or ticking stopwatch away from your ears until sound is no longer heard. Record the distance for both ears using a meter stick. Based on our results, it surpassed 1000 centimeter or 10 meters using a metronome application. This can be faulty since it is highly dependent on the volume of the chosen equipment rather than your ear's ability. Lastly, for the hearing test, we are testing for the sound location. Have your lab partner sit with eyes closed. Strike a tuning fork in different locations. Strike it above head, behind head, left side, right side, in front of head, and below the chin. The sound should be perceived at the location where the fork was struck. As we can see in our results, the sound was received in the rightful location, indicating that the ear is normal. To conclude, the first half of the test involves the auditory senses, wherein hearing is tested. Hearing loss is a common disorder that continually progresses as we age. Based on the results of the tests, there were no signs of hearing loss or deafness and were considered normal. For ages 20 and below, hearing problems are uncommon but not impossible. Therefore, it is crucial to keep our ears protected against damaging sounds and substances to keep hearing loss at bay.